Welcome back. Topic for today's lecture is fascia of the neck. Surface anatomy. Once you go for dissection, whatever you see here, this region first, the skin and the platysma muscle. So what you can see here is the platysma muscle, which can be seen by violently clenching the jaw. So first whenever you cut the skin, you will also cut the platysma muscle. It lies in the superficial fascia. Then the palpable pulses, which are asked in your living anatomy as well. Carotid pulse, which we can palpate against the anterior tubercle of C6 vertebra. The facial artery, which can be palpated along the anterior border of the masseter over the mandible. For that, you have to clench your teeth tightly. Then superficial temporal artery, which can be palpated over the zygomatic arch immediately in front of the auricle. So this what you can see is the superficial temporal artery. This is a facial artery. Carotid artery cannot be seen here because it is at the neck and palpated against the C6 vertebra. Fascia of the neck. The fascia of the neck is also known as cervical fascia. It actually makes compartments for the structures present in the neck, and also it allows easy movement of the structures over each other. The layers are, there is superficial cervical fascia and deep cervical fascia. Superficial cervical fascia, it is a thin layer of connective tissue and it lies between the deep layer and the skin. So दोनों के बीच में जो होता है वो superficial cervical fascia, like any other superficial fascia present between the skin and the deep layer, deep fascia. Superficial cervical fascia contains cutaneous nerves, blood vessels, less amount of fat and platysma muscle, which we have seen. The deep cervical fascia, which is actually very important. It consists of investing layer, pretracheal layer and investing layer of deep cervical fascia. ये क्या होता है? This is the most superficial layer of fascia, that is skin निकालने के बाद, वो skin and superficial fascia निकालने के बाद जो fascia दिखता है, that is the investing layer of the deep cervical fascia. It surrounds the entire neck. If you can see the pointer, I will slowly move the pointer. This part is the investing layer. This part, it is completely going round. ये जो सेक्शन लिया है TS, उसमें सब जगह से साइड से जो ग्रीन कलर का है, this entire is the investing layer of the deep cervical fascia. इसका attachments देखते हैं क्या है. The attachments are superiorly, it is the external occipital protuberance, the superior nuchal line, the mastoid process, the zygomatic arches, and the inferior border of the mandible. वैसे ही वो side भी. Inferiorly, it is attached to the manubrium, the clavicle, the acromion process, if you can see, and the spine of the scapula. Okay, so superior attachment देखा हमने, inferior attachment देखा. Anteriorly, it is attached to the symphysis mentis and the hyoid bone. If you can see here, the hyoid bone. This is the anterior attachment. Posteriorly, ligamentum nuchae, if you can see this diagram, till the seventh spine or the spine of the seventh C7. Seventh cervical vertebra. So if you can see a ligamentum UK, this red color thin, means this investing layer of deep cervical fascia, it completely encloses the neck like that of a collar. एक collar की तरह वो पूरा surround करता है. In this diagram you can see this investing layer of the deep fascia, ये आगे जाके ये split होता है. It splits into two layers, the superficial layer and the deep layer. This is not showing very clear, but ठीक है. Superficial and deep layer, it encloses the sternocleidomastoid muscle and the trapezius muscle. It also encloses the submandibular gland, parotid gland. So investing layer का speciality ऐसा है, ये सब दो दो चीज को enclose करता है. Okay, let us see one by one. Okay, this is the suprasternal space. So the investing layer of the deep cervical fascia, it encloses two spaces, suprasternal space and there is some space known as supraclavicular space, जो आगे एक डायग्राम में मैं दिखा दूंगी. Okay, suprasternal में sternum के ऊपर. What I am trying to emphasize is the investing layer splits into two layers. Okay, and encloses two structures which pierce the investing layer are the superficial veins, cutaneous nerves. Okay, let us see this diagram. So in this diagram, we can see again here investing layer of the deep cervical fascia splitting and enclosing this muscle, which is the sternocleidomastoid. वापस ये ऐसा बनके it forms the roof of a triangle. Again, it is enclosing this muscle, which is a trapezius. So we said it encloses two muscles, the sternocleidomastoid and the trapezius. Next, here I can see, which we have done with parotid gland, the investing layer of deep cervical fascia encloses two glands, the parotid gland and the submandibular gland. Parotid gland को ये जो fascia हमने बोला, parotidomastoid fascia, which we said is very tight, so any enlargement of the gland, it is very painful. So this fascia or the superficial fascia of the parotid gland is formed by the investing layer of deep cervical fascia. So this is how it is enclosing the two glands. The posterior layer of the fascia, it goes to the styloid process and forms a stylomandibular ligament. Okay, so we now saw two glands, how it is enclosing. It also forms facial slings of two muscles, omohyoid and digastric. दोनों muscles को दो दो heads है, उनके जो facial slings बनते हैं, that is also formed by the investing layer of deep cervical fascia. So here we can see the investing layer of deep cervical fascia is enclosing the omohyoid. Okay, it is going towards the clavicle and splits into two, thus forming the supraclavicular space. So we saw the suprasternal space, now this is the supraclavicular space. It is said that the same fascia completely covers the clavicle and then forms the clavipectoral fascia. Okay, some books mention that it is the investing layer only which is forming this. Some books mention that this is a separate fascia and it ends at the clavicle. So we saw that investing layer splits and encloses two muscles, trapezius and the sternocleidomastoid. It forms roofs of two triangles. It encloses two glands and splits to enclose two spaces. It is thickened twice to form fascia, two fascias. That is, one is the parotidomastoid, other is the stylomandibular, which is also known as the stylomandibular ligament. And it forms two slings for omohyoid and digastric. It also gives rise to two other fascia, that is the pretracheal and the prevertebral. So starting में जो हमने बोला, in deep fascia has got three parts, the investing layer, the pretracheal and the prevertebral. So it is said that the investing layer of the deep cervical fascia gives rise to pretracheal and prevertebral fascia. So this part, slide is important. asked in MCQ as well as Viva. Now we come to the pretracheal layer of deep cervical fascia. Pretracheal, as the name says, it lies in front of the trachea, front and side of the trachea. तो उतना ही होता है. It extends from hyoid bone to the thorax. Thorax में जब भी वो जाता है, it blends with the fibrous pericardium. So hyoid bone से नीचे तक ही है. Attachments: superiorly the hyoid bone, the oblique line of the thyroid cartilage and the cricoid cartilage. Now this thyroid and the cricoid, these are the cartilages which are present anteriorly. We'll see that. Inferiorly it blends with the arch of aorta and thus blending with the fibrous pericardium. On either side it blends with the carotid sheath. Let us see if we have diagrams to understand this. Okay, so ये है pretracheal fascia, hyoid bone से लेके fibrous pericardium तक. On the way, it is enclosing this thyroid gland. This we are seeing the thyroid gland. तो ये pretracheal fascia यहाँ से जा रहा है, enclose कर रहा है thyroid gland को. Okay. We also know that there are certain muscles below the hyoid bone, and these muscles are known as infrahyoid muscles. So infrahyoid muscles are omohyoid, sternothyroid, sternohyoid and thyrohyoid. तो ये थायरॉइड बोन से अगर ये फेशिया नीचे जा रहा है तो ये मसल्स को भी एनक्लोज कर रहा है along with the thyroid gland. So this is the thyroid gland. This is the pretracheal fascia. The investing layer of fascia is giving rise to this pretracheal fascia. You can see here it is enclosing the infrahyoid muscles as well and enclosing the thyroid gland and going here towards the carotid sheath. So we said that on the sides it is blending with the carotid sheath. Posteriorly the layer is ill-defined, and that is the reason why when there is enlargement of thyroid gland, it usually presses on the esophagus. It can expand. This is to show you only the pretracheal part. Okay. So pretracheal layer, we said it forms. Now we said it is enclosing the thyroid gland. Okay. Now this also actually forms a ligament of Berry, which connects the lateral lobe of the thyroid gland to the cricoid cartilage. So with the thyroid gland, we will again explain what ligament of Berry is. Now the next layer, that is a prevertebral layer. Again, prevertebral, the name suggests, in front of the vertebral muscles. Okay. If you can see here, this is the prevertebral layer. ये वर्टिब्रा है, इसके आगे ये मसल्स है, उसके ऊपर ये आ रहा है प्रीवर्टिब्रल लेयर. So it is extending from the base of the cranium to T3. Okay, and anteriorly, when it is extending, it fuses with the anterior longitudinal ligament. So here, if you can see, prevertebral layer. If you see the prevertebral layer going laterally, it forms the floor of the posterior triangle. The cervical plexus and the brachial plexus lies behind the prevertebral fascia. Other derivatives of deep cervical fascia are carotid sheath and the buccopharyngeal fascia. Let us see. We have seen this. The pretracheal layer, we said it blends on the sides with the carotid sheath, which means that the carotid sheath is formed anteriorly by pretracheal layer of the fascia. And in this diagram, if you see, this is the prevertebral layer which is forming the posterior sheath of the carotid. So carotid sheath is formed anteriorly by pretracheal layer and posteriorly by prevertebral layer, asked in your MCQ. Carotid sheath can be asked as a short note also. The carotid sheath, so it contains the common carotid and the beginning of the internal carotid artery, internal jugular vein and the vagus nerve. So if you can see this on the side, artery, vein and the nerve. This is a lymph node which is seen. This diagram is very important. Schematic representation, if you get in any of the books, you can, it will be helpful to you all. This I tried to find one, but understanding wise it is not so good, but it can be drawn. This is the investing layer. Oops, sorry. This is the investing layer. It is enclosing these two muscles, and it is how it is forming the slightly blending. Okay, here, and this is the pretracheal layer which is forming the anterior sheath, and the prevertebral layer which is forming the posterior sheath. This is the carotid sheath, how it is enclosing the carotid artery, common carotid and the internal carotid, internal jugular vein and the vagus. Ansa cervicalis lying in the anterior wall and sympathetic chain lying posteriorly. This is about the carotid sheath. Buccopharyngeal fascia. Buccopharyngeal means the fascia lying over the buccinator and the pharynx. This is the buccopharyngeal fascia, this dotted line. It extends from the base of the skull to the esophagus. So this is the pharynx. So this is the buccopharyngeal fascia. This is the prevertebral layer of the fascia. So the space between the prevertebral layer and the buccopharyngeal is known as the retropharyngeal space. Pharynx के पीछे है. Okay. If you can see here, the buccopharyngeal, and this is the prevertebral we have discussed already. एंड बॉक्सीनेटर एंड फेरिंग्स के पीछे भी होता है, ये दोनों के बीच में ये जो जगह है ये रेट्रोफेरेंजियल स्पेस है. Retropharyngeal pharyngeal fascia and the prevertebral fascia. This is asked as a short note. This diagram is also easy to understand. Buccopharyngeal fascia lying behind the pharynx, the prevertebral fascia. So if I want to describe the retropharyngeal space, I'll say that it is bounded anteriorly by the buccopharyngeal fascia, posteriorly by the prevertebral. It is the carotid sheath. Above, it is the base of the skull. And below, it is open and continuous with the superior mediastinum. This space actually allows the pharynx during deglutition. This space. Very easy diagram. You all can try drawing this diagram. Carotid sheath hai, vertebral fascia. This is the space. In this space, actually, if there is any acute infection, pus can be collected in this space, and this can extend into the mediastinum. We said it is open to the mediastinum. Also, the pus can go laterally to the carotid sheath. It may push the posterior wall of this pharynx. Okay, and this pus can cause swelling. See, it can push this carotid, it can push the pharynx, okay, and extend up to the superior mediastinum. This is all in deep cervical fascia. We will be back with our next lecture. Thank you.